Well, I just wanted to start with a couple quick reminders. We have the Q&A function open, so please feel free to enter in your questions as we go, and we'll have some time at the end for questions. And uh, we also will be recording this panel, but we're going to stop the recording for the Q&A portion. So everyone who has registered and is joining will be able to receive a recording afterwards. I believe that is all of my reminders. So with that, I will pass it over to Grace. Thanks so much.
Hi, everyone. Thank you so much for being here today. We on the panel and hosting this obviously think this is a really important topic, but we're glad that you do too. And the goal of this briefing is to inform and educate and answer your questions. So we'll have our panelists answer some questions that we've prepared, and then we'll make sure that we're leaving plenty of time for Q&A. Please use that Q&A function to share your questions, and we'll have those shared out at the end. I just want to give a brief introduction to myself and then also what we are talking about today. And then I'll introduce our panelists and we'll get started. So, as very brief background, a new dietary guidelines was released January 7th by USDA, the US Department of Agriculture, and Health and Human Services, HHS. The DGA provide science-based advice on what to eat and drink to promote health, reduce risk of chronic disease, and meet nutrient needs, and they're updated every 5 years. Typically, the DGA is informed by an independent review panel called the Dietary Guidelines Advisory Committee, but this time the agencies used a different process, and they created a scientific foundation document with new authors. In that document, the agency shared that they rejected 30 of the DGAC's 56 recommendations and instead conducted their own scientific review with their newly established panel. Based on that review, which was grounded in the principle that all minimally processed foods are inherently healthy, they made some key changes. They created a new food pyramid that emphasizes meat, including red meat, whole milk, butter, fruits, and vegetables, and de emphasizes grains, at least on the pyramid, not necessarily in the serving suggestions. Their new guidelines maintain the quantitative saturated fat and sodium limits, but then have some contradictory guidance throughout the document and increase recommended protein intake to double in some cases. And the guidelines also get rid of the specific recommended drink limits for alcohol and include recommendations to limit highly processed foods using that explicit terminology, though the past dietary guidelines did recommend minimally processed foods. So, with that summary, I want to share with you that today we have a lot of different experts on the call. Toni Jackson speaking from the school perspective, Kelly Horton and Alison Steiber speaking from Academy of Nutrition and Dietetics on the impact on clinicians and dietitians and nutrition education, Laura Borth speaking to the impact on nutrition programs for older adults, and then Valarie Jernigan, Dr. Jernigan, speaking to the process that the Dietary Guidelines Advisory Committee followed and how what happened differs from that process. And she is incredibly able to speak to that because Dr. Jernigan was on the 2025 Dietary Guidelines Advisory Committee. And with that, I do want to ask my first question to Dr. Jernigan. So there's a lot of confusion and contradiction in this dietary guidelines for Americans. I think a lot of people are asking, how did we get here? And Dr. Jernigan, as a member of the 2025 Dietary Guidelines Advisory Committee, how would you describe the rigor and transparency of your committee's review process? So, first part of the question. And then, how does that compare to the methods used by the scientific foundation reviewers for the new DGA?
Mhm. Hello, thank you, Grace. Thank you, everyone, for being part of this. And I'm happy to be here and answer your question. I am one of a group of independent experts that was jointly appointed to the DGAC. We are selected for our scientific expertise in nutrition and public health, medicine, and related fields. And we serve on a fully voluntary and temporary basis for each of those guideline cycles. Our role is very specific and very limited, and it's very clear. We are required to review the latest peer-reviewed science and scientific evidence on diet and health. identify key findings, and produce a scientific report with recommendations. Federal agencies then use this report with public input and policy considerations to develop that final dietary guidelines for Americans. Our review process is by design very rigorous, systematic, and transparent. Our committee follows predefined research questions and protocols. We use established methods, so we use systematic reviews, data analysis, food pattern modeling, and we rely on peer-reviewed and publicly available evidence. Our meetings are open to the public, all deliberations are documented, and all materials, evidence reviews, and the final scientific report are published online. And this structure minimizes bias. The structure makes any assumptions and limitations explicit, and it allows policymakers, researchers, and the US public to see how scientific evidence is evaluated before it informs the final dietary guidelines for Americans. I think, in contrast, the scientific foundation that informed the latest guidelines did not follow the DGAC's established methodology. The group wasn't selected through the usual vetting process that we have. They didn't use a transparent, publicly available protocol, and their process lacked clear peer review and broader scientific community input. Much of its work and how evidence was evaluated has not yet been made widely public. Materials from the new process, including protocols, evidence summaries, and the basis for many recommendations, have not been released or documented in the same systematic way. So the scientific rationale is harder for researchers and the public to evaluate. The DGAC typically has many months to conduct our reviews before we produce a final comprehensive scientific report. And the new foundation worked under what looked like really compressed timelines, and its output was incorporated into the guidelines alongside, or even in some cases instead of, the DGAC. And that raises some concerns about thoroughness. Members of the DGAC are nominated and selected to serve on the committee based upon our scientific credentials, and there are required formal disclosures of conflicts of interest that we are required to make. And that same process did not take place with this scientific foundation. So any ties that those members might have to specific food industry groups did not have to be disclosed. So in summary, DGAC process is by design evidence-driven, methodological, transparent, and we don't see that same thing from the foundation. We see a process that lacks that same level of open scientific review, making it really hard for outside scientists and the public in general to assess the rigor of the evidence behind their latest guidelines.
Thank you, Dr. Jernigan. And I'll put in the chat for folks interested, the scientific foundation that Dr. Jernigan is referencing is a document that was released along with the new DGA. That was their basis for the decisions, the final recommendations that they made. And in that scientific foundation, if you're curious, you can see at least the conflicts of interest that were disclosed, and there are multiple with the beef and dairy industries. And so just pointing out that all of that is information that's been released by this administration, and that is available. But of course, the points that Dr. Jernigan made about scientific rigor and transparency are valid, incredibly valid. And with that, so that was kind of an overview of how did we get here? What was the change in the scientific process that led to such a drastically different dietary guidelines? And now I think a lot of people are asking, what's next? What does the impact look like? How are these dietary guidelines going to affect people moving forward? And I want to turn my attention to Toni. So Toni Jackson is a school nutrition director. She is on the ground implementing these changes when there are changes, and she is working in Kentucky. She was the 2025 Southeast Regional Director of the Year and the Kentucky Director of the Year, so incredibly knowledgeable on how to implement DGA changes and guidance into school meals for children. And the new DGA, as an overview, increases the protein recommendation or the recommended serving size and intake for folks, emphasizes animal protein and full fat dairy, has stricter added sugar limits, especially for elementary school age children, and eliminates subgroups for protein and vegetables. And changing those subgroups from vegetables would be a change for school nutrition standards. We don't yet know, to be clear, how these changes will be translated into nutrition guidance, but Toni, what challenges or changes do you anticipate if these guidelines are translated into updated standards for school meals?
Well, Grace, thank you for that awesome introduction. Made me feel good about myself there for a minute. So I want to give a brief, real quick, where does school nutrition get our money? That's people, oh, our kids eat, all of these kids eat for free, and I pay school taxes. Your school taxes do not go to feed children. We are a federally funded. So if your kids are eating free, like the school that I currently at, we are CEP, Community Eligibility Provision. Because we have a high enough percentage of children that qualify for food stamps, Medicaid, passport, they're homeless, they're foster kids, we can offer free meals to all. What we do is that magical number of 1.6 gets multiplied by the amount of kids that are on those programs, and that's what we get reimbursed for. The rest, we only get 40 cents. That sounds like a lot of numbers being thrown at you, but so the school I'm at, we basically get 77% of our meals fully funded. It's like a little over $4 for lunch. The rest, we only get 40 cents a meal. So we're already taking losses on stuff. Yeah, we work on an extremely tight budget. We are considered a nonprofit. We're not allowed to hoard money and sit on all this money in the bank. Our money has to pay for all of our food, obviously, all of our garbage bags, your paper products, your cleaning supplies. It has to pay for all of your ovens, which can range between sometimes $50,000 to $100,000 an oven, your dishwashers, all of these things. Plus, we have to pay for our salary for our staff, even though they are school employees. That salary is paid directly through what we get reimbursed for these meals. So when you break it down, we get maybe, if you do it right, you're maybe looking at a little over, maybe $1.26 is what you have to spend on a meal for a child. So you take that, keep that in mind when we're discussing the things about the upcoming rules and how this could affect kids. So one of the big things they're pushing is meat. And, I'm Kentucky. I know some people don't count that Southern, but if you listen to my accent and the y'alls, I'm Southern. I do enjoy a steak and potatoes. I enjoy, we make meatloaf. We love our meat. Yes. We have, I have cows around me, but we all know meat's going to cost more. I mean, even chicken nowadays, it costs more than if you were to go buy some yogurt, or if you were going to buy, berries even. Your meat costs more. We can't afford that. Right now we do portion, we have portion control. They get their meats, their grains, their fruits, their vegetables, their milk. You want us to put more money into meats, we're going to need more money in return to offer that. The milk bill passed, where we're going to have whole milk in schools. Okay. That doesn't increase kids to actually eat lunch. No child is going to go, I've never ate school lunch, but now they got whole milk, I'm jumping on board with whole milk. Now, do I prefer whole milk? Sometimes, yeah. And we welcome the opportunity to give the kids. Anytime we can give the kids better things, we welcome it. We love the idea, but we have to be able to afford to do it. They're taking out the saturated fat doesn't count. Whole milk has more sodium too, has more calories. We are on weekly calorie and sodium limits. Everything we have is so very regulated. It gets into so if I'm going to offer whole milk, which we can only offer whole milk at lunch, not at breakfast. If I'm going to offer a different liquid drink, what food do I take off? What meal has to change because I'm putting sodium and calories into a different drink and not into food? So it gets really, what is the give and take there? There's the talk of the processed food. At the district that I'm at, we're cooking sometimes 3 things a day that is scratch cooking. The kids' favorite thing, we make a buffalo chicken dip from scratch. And that is, yes, we have to really work on the sodium on that. That is a scratch specific school meals kind of thing that the kids sometimes says, like, that's a little, you need some salt in that. I'm sorry. But our kids love it. But you look at that and you say buffalo chicken dip. Do you think a first grader is going to go crazy? Some will, yes. There's always going to be one. But they like their chicken nuggets. While there is no definition of ultra processed food, I'm pretty sure they might put chicken nuggets into ultra processed food. Lunch ladies are not coming in and taking raw chicken and cutting it up and breading it and cooking it to make chicken nuggets for kids. That is not realistic. And we have to offer children food that they do know. We have to offer them food that they will enjoy, food that they will eat, food that will make them full. And chicken nuggets and cheeseburgers, chicken tenders, that's what speaks to our younger crowds. Now, our chicken tenders and chicken nuggets, those are made with whole grain. They're on the healthier side. They are the lower sodiums. The products that we serve in schools, a lot of the times you can't even find them in the grocery stores. All of our cereals are 6 grams of sugar or less. You're not going to find that kind of tricks on your cereal aisle. Our Doritos, we have to offer specific Doritos to even sell a la carte. Those are reduced fat Doritos that are made specifically for school use. You don't find those anywhere except in schools. So we have worked as a system to meet all these guidelines to provide the healthier food options for children while maintaining food that they will like and enjoy. When we start coming in there and making more changes without speaking to the people who are in school nutrition, we get very scared because this is our passion. We know what children like. We see what they will eat. And why we will always welcome any kind of thing to make better meals. We want to make sure our children are fed and taken care of, and we are serving them the best meals we can. I think if more thought was put into how can we help the children and the school nutrition realistically achieve the goals and set out maybe schedules that it would work better, because we are in the process of getting rid of all dyes in food. We're doing all of these things. We're working on doing things even better. That I think when we start getting rid of subgroups and we start doing all that, it sounds great. Hey, we don't have to serve that red orange. But how is that really going to affect anything in a day-to-day operation when it comes down to it? That isn't anything that big to me.
Thanks for sharing, Toni. And I know that you will be hopefully one of the first people informed on those changes.
I
And
hope so. I did just get back from a conference in Austin that the USDA did speak to us. And at that time, I came back Wednesday, at that time, they had no answers for us, but that, the stuff had just been released.
And I think I saw a question in the Q&A about, how will these be implemented? What is the guidance? And Toni just answered that. Basically, we don't know yet. And I think, that means maybe nothing to worry about too much or panic over in the future, but it is tough for folks who have to plan very far in advance with their budget, with their funding, to not know the answer to that question. So we're just trying to highlight the not knowing is also difficult, even if ultimately there aren't that many changes. And I do want to highlight the impacts on another program. So thank you, Toni, for your thoughts. And I'm sure there will be questions at the end for you too. But Laura Borth is with us. She is the policy director of the National Association of Nutrition and Aging Services Programs and the policy director of Defeat Malnutrition Today. And Laura, can you speak to these challenges and changes as well? You work with a very different population, but older Americans also participate in programs that are required to follow the dietary guidelines. What challenges might Older Americans Act programs like Meals on Wheels and Meals Served in Senior Settings face in applying the new dietary guidelines to congregate and home delivered meals?
Yeah, thanks, Grace, and hi, everyone. So a lot of people are not that familiar with Older Americans Act programs, but for almost 55 years, these programs have served older adults who are 60 or older with the greatest social and economic need. And so this can look like homebound seniors who are getting that Meals on Wheel delivery, or an 85-year-old who's come into the senior center to play bingo and hang out with her friends and get a nutritious meal. So our meals must follow whatever the current DGAs are, and they must also provide 1/3 of the DRIs, the dietary reference intakes. These are levels determined for protein, vitamins, other nutrients. And then our meals must be appetizing, kind of like school meals. It's great if you serve them something, but if they don't want to eat it, then who have we helped? And so every year, our programs serve 240 million meals to 2.5 million older adults. And the process for these updated DGAs is a little different than school nutrition. Um, our states are expected to implement the DGAs. And so that's mostly through the State Unit on Aging Nutrition Director. They must update their meal programs and their nutrition education to be whatever is the current law. So they're expected to begin now, which is great because we also haven't had much guidance. And thankfully, the state nutrition directors are meeting this week to start peer sharing and discussing how they're going to make these changes. And so two issues, I think, is the cost is first and foremost. Increasing vegetables, increasing meats, that's going to be expensive. Adding in trained staff to prepare more whole foods. And we're already stretched thin. Surveys show that 1/3 of our meal programs have a wait list. And there's additional costs would only increase this, or have programs who have to start wait lists. And there's 2.5 million seniors who could benefit from our meals who programs don't even reach out to. So, while these DGAs are in some ways may improve nutrition, it shouldn't be at the expense of people being able to receive a nutritious meal. And then the clarity issue, almost all older adults have a chronic disease, and many may have chronic kidney disease, at a stage where protein makes an impact on their health and they don't know it. And so, we're concerned about these higher protein intakes having unintended consequences, which is, why we would prefer it to come through the DRIs and have a little bit more, evidence backing it. Additionally, the older adult section, we wish it was a little more directed. And so we're kind of left with the question of like, who will untangle these questions for the senior nutrition programs? And so there's really a need for nutrition education at a time when we don't have people at the national level to provide that. The Administration for Community Living, which governs our programs, lost half its staff last year, including all regional staff. So while they do still have multiple dietitians to support the network, that's not going to take the place of all those other folks. Um, yeah, and I'll leave it at that for now.
Thanks, Laura. Some more, not necessarily clarity, but more examples of what's needed when guidance is finally provided for how to implement. So I hope those questions in the Q&A are being answered. In summary, we don't know. We're looking forward to knowing and hoping for clarity from the administration on implementation. Other questions that I'm seeing a ton of in the Q&A, I really appreciate everyone's interest in if you're a nutrition educator, if you're a registered dietitian, how do you communicate these changes to your patients, to your students? And to answer those questions, I'm going to turn to our experts from the Academy of Nutrition and Dietetics, both registered dietitians themselves. And Kelly Horton is the Senior Vice President of Public Policy and Government Relations at A&D, the Academy of Nutrition and Dietetics. And Alison Steiber is the Chief Impact Officer at Academy of Nutrition and Dietetics. So to both of you, as we've heard, this does impact people who use federal nutrition assistance programs like the ones that Toni and Laura are involved in, but it doesn't only impact people in those programs. It impacts anyone who wants to eat healthfully, who wants to go to their dietitian. What are the implications of the new dietary guidelines for nutrition education and clinical practice? And I know those might be two separate areas.
Sure. Thanks, Grace. Thank you so much. And thank you, Dr. Jernigan and Toni and Laura. My brain is swirling with some of the comments that you have already made. I'm Kelly Horton, Head of Government Relations and Public Policy for the Academy, as Grace said. I just want to back up just a second, and having heard Toni, just to kind of give the numbers here that we're talking about the impact. So it's 30 million kids across the U.S. receiving those lunches and meals and snacks in school programs. And I think it's about 33 million older adults receiving those Meals on Wheels or eligible to. I think you mentioned there's 2 million that aren't getting them. And then we haven't talked about WIC, but WIC has almost 7 million women's infants and children. And then we've also got the Head Start programs, which is millions of children across the US. And while WIC and Head Start aren't directly impacted by the dietary guidelines, they are impacted by the dietary guidelines. And right now, the WIC food package is very much aligned to the previous dietary guidelines and as our Head Start programs. And so I just want to mention those because I want to make sure we keep that in mind as we go through this. And as you mentioned, we represent thousands of registered dietitians and dietetic techs who are working in schools, working in older adult nutrition programs. Often they're the directors working on those programs. We also have them working in WIC and then SNAP, and we haven't talked about SNAP, and I'm going to focus on that a bit. So we've got a lot of folks who are trained to use evidence-based nutrition and dietary guidelines in order to implement those programs. And then, and as you said, it's not just in those programs, but in broad society. But those programs are required to adhere to the dietary guidelines. So the Academy views the dietary guidelines as a science-based framework that shapes healthcare, public health messaging, and those federal nutrition programs that we just talked about. And while many of the recommendations align with the longstanding nutrition science in these new dietary guidelines, there's other elements that raise significant concerns. Overarching, we kind of feel this is a little bit of a mixed bag, and there's no one size fits all with these dietary guidelines. And focusing on one-off nutrition topics really distracts from the addressing systemic challenges in deriving the improvements in chronic disease. So that's what we're really focused on. And with that question that we have in the chat around, well, what do we do as dietitians? So let me just level set what the Academy agrees on. We agree with the core principles in the guidelines of eating more fresh fruits and vegetables and whole grains, emphasizing fiber, and we're really thrilled to see microbiome health mentioned in these dietary guidelines. That's very exciting. And also limiting processed foods. Toni mentioned ultra-processed foods. I've got a lot of questions from folks about the dietary guidelines mentioned highly processed foods. And that's on purpose, and it makes sense actually, because FDA is going through the process of defining what an ultra-processed food is. So HHS and USDA did not jump the cart, and they, instead of using ultra-processed foods, they use the word highly processed foods. Basically, admitting that we don't yet have a definition for ultra processed foods. But we do agree with limiting processed foods. We also agree with what Toni said. We have thousands of dietitians, like I said, involved in school lunch, and there's been massive improvements and really great efforts around the foods that are offered in schools. We are focused on limiting those that are especially high in added sugars and sodium. And Toni also mentioned that, and that it's really difficult when you're dealing with foods in mass production, food facilities. We're also focused on maintaining a limit of no more than 10% of total calories for saturated fat while prioritizing healthier fats. So those recommendations are really consistent with decades of evidence, long-standing academy guidance. We're not surprised by those things, and they are solid. We have concerns around the saturated fat recommendations, especially around the emphasis on butter and beef tallow, red meat, and full-fat dairy. It's inconsistent with the recommendation of limiting saturated fat to 10% of your total calories. If you add those foods, it's going to be hard to stay within that 10%. And the evidence also consistently shows that replacing saturated fats with unsaturated fats, especially those polysaturated fats from plant oils such as olive oil, canola, soybean, safflower oil, and sunflower oils, you can reduce cholesterol and cardiovascular disease. And cardiovascular disease is one of the #1 killers in the US. So this is really important that we get this right. Cardiovascular disease is the leading cause of death, a leading cause of deaths, and our dietary choices can help reduce by reducing and replacing saturated fat when possible can help you moderate your risk factors. So we want to make sure that the general public knows that and that our kids and our older adults are also set up for long-term health success. The other thing that we have some concern around is around dairy. The new dietary guidelines, and before I forget, Toni also mentioned, when you add in the whole milk might be more sodium. So you've got these trade-offs. And then also, if the new guidelines don't consider individuals who cannot or choose not to consume dairy products, what's the guidance for them? So we've had a lot of questions come in around that. A lot of people choose a vegan diet or vegetarian diet, or they have lactose intolerant. And children and pregnant individuals and older adults and people with chronic conditions should really be working with a registered dietitian or their healthcare provider to ensure that they're getting adequate intake of the nutrients of concern, such as calcium, vitamin D, and protein. And Alison, is there anything else you wanted to add about dairy? Or any of the things I just mentioned?
I think, yeah, one thing I want to say about dairy in particular, and I think we all know this, but it's worth repeating, that the change in fat percentage doesn't change the nutrient profile. The amount of calcium, the amount of phosphorus, magnesium, potassium, protein, those are all the same. What changes is the percent of fat and the amount of calories. So we have to think about the individual. What do individual children need? And really allow them the choice to say, if you're a child who would do great on whole fat milk, great for you. If you're a child who needs to have a little bit lower calorie or fat intake, you have these options. So, it's not a one size fit all. And I think that is important as we as registered dietitians, just kind of thinking about practice, whether it's practice within a healthcare environment or practice at an individual consulting, that our job is to individualize and personalize the nutrition advice that we provide. And we do that by thinking about the whole person, what they can afford, what they need metabolically, what their cultural preferences or their religious preferences are. And we need to think about that regardless of what the current DGAs say.
Great. Thank you. And a couple other points. You mentioned nutrition education. So the Academy is a huge advocate. And again, we have hundreds of dietitians who are involved in nutrition education across the country, in particular, what was the SNAP education program. The SNAP education program, if you're not aware, SNAP nutrition education program was scratched out by the last HR1 and no longer has funding. There's some states, I believe, still are spending their money, but in essence will not have that support. So we have lost that tool of a federal nutrition program that helps to educate folks at a lower income and others on nutrition education. Now, if we did have funding for the nutrition education program and those ones that are currently continuing, they need to abide by the dietary guidelines. So that's another implication of the dietary guidelines. Also wanted to just touch on, but we will continue to advocate for nutrition education funding. We need that restored. And then you talked about, I touched on SNAP, and we've heard a lot about affordability and access. And we're hearing from everyone across every income, SES. Food prices are skyrocketing. Everything is getting more expensive. Rent, mortgages are getting tough. All of those things. And so everybody's struggling with affordability across America. And particularly those that are living at the poverty level or below, they are being left behind. And yes, the dietary guidelines are based on science. We also need to make sure that they're accessible and affordable, and that we have the food system and environment that helps people to buy those foods. Right now, we have an activist environment in the states where we have over 130 state bills that are focused on restricting ultra-processed foods in schools, or synthetic food dyes, or foods in SNAP. Most of them are focused on schools because that's an environment you can control. It's very difficult to have a bill. There have been some that control more of a public health environment in a city or county, but school's an easy target. Those are going to be very difficult to implement. And I think we had almost 20 bills passed in the last session, maybe between 10 and 20 bills. We will see those bills be reintroduced this year. In fact, we're already seeing folks gear up for that. And just to kind of give you an example of the impact of that, and not to get into the other discussion, but there were also 130 vaccine mandate repeal bills. So we're at the same level. Nutrition is at the same level as that national discussion, and the same level of speed of those bills going through the state houses. So I want to make sure we're aware of that. And then the other point I wanted to make based on what Toni was talking about is we have seen not enough investment in equipment for schools and for Meals on Wheels programs and others to invest in doing scratch cooking, or in having more fresh foods, or having foods that doesn't expire by the end of the day type of thing. And so we need to, and we have a lot of partnership with the School Nutrition Association. A lot of our members are similar, and we're focused on how do we get more staff? How do we train those staff? We need culinary training, we need equipment and infrastructure, and we need Congress to make that investment. We don't see that investment. I have to relook at the bill, but I believe that we don't see that investment in the current bill that's funding bill that's on the docket. And that's concerning. And the last comment I'll make around access to food. So we heard some comments earlier last week about, a piece of chicken, a piece of broccoli, a corn tortilla, and maybe another item, and that's affordable within in SNAP. That to me as a dietitian is a serving. It's not a meal for someone. So we're really talking about trying to meet your nutritional needs, reduce your healthcare costs, and have better health outcomes on such a limited benefit. And frankly, for half the price of a coffee if you live in the city. And Alison, is there anything you want to add from a practice perspective that I might have missed?
No, I don't think so. I think that was great. We want to leave time for questions, so I'll see what questions we get.
Okay. Thanks, Grace. Back to you.
Of course, thank you both. And the first question might be coming right back to you, but I actually open this up to any of the registered dietitians or RDs that we have on the panel, which I know there are multiple, Kelly and Allison included. And you touched on nutrition education, you touched on clinical practice, but there are a lot of questions in the chat about My Plate. My Plate is gone. Those resources are gone. What do we do? Can we still use them, even if they're not, supported by the federal government anymore or used by the federal government anymore? For the RDs on the call, what are your thoughts on that? Is My Plate still a valid resource to use? Are there other resources that you would recommend? Do we have a simple visual that people can use to guide their eating behavior?
You want to kick off, Allison?
I would just say, we don't have an official stance on this from the Academy, but my personal opinion is My Plate is a well-researched, validated tool. And if you have materials to use with My Plate, I would encourage you to continue to use them. The great thing about My Plate, as you all probably know better than anyone, is that it has serving sizes. It shows portion amounts. It helps a very simple visual say, this half of your plate should be fresh fruits and vegetables. This half should, or this quarter should be protein foods and this should be grains. And so it really gives us a great visual to think about amount. And I think that's very difficult with our current visual. So I personally would agree with continuing to use MyPlate if you have it as a resource.
And I'll just add, you mentioned that is off the USDA website right now, and also what disappeared with that prior to the release of the dietary guidelines is all the multicultural and language tools. And we are a multicultural country, and I know that many dietitians use those, particularly in federally qualified healthcare centers and other places, so that people could understand them because they're in other languages. So we're having conversations about that. That is millions of dollars worth of investment, and to have that replaced is going to be difficult.